the youth prison. I'm actually right from there right now. So I'm there on Wednesdays. I visit the youth. So our non-for-profit goes into like youth areas, people who don't have many resources, and we're helping them with their, mental health, their um, health conditions that they don't have access to, and I'm kind of focusing focusing a little bit in that non-for-profit direction right now. So we're, just trying to make up for some of the things that I felt I wasn't doing enough of.
So you still have like a practice as well on this?
So the way I sustain the non-for-profit is because I still have lots of patients from before, and so that allows me to just kind of stay afloat, and then I can branch out a little bit to non-for-profit stuff, and then what's it called? The non-for-profit stuff is, there's not like.
So is it close where where your office is?
I live I live on a small farm
Okay.
in Norfolk.
So do you treat like virtually or?
So my main patients that were from before are all virtual.
Okay.
So I keep that going.
Yeah.
And I'm basically branching into like non-for-profit, and then that may turn into being able to take more patients in general. But like right now, it's it's kind of full it's full, right? All I have is patients from before, and now a little bit of non-for-profit stuff that I do. So I don't have a conventional practice in that sense, but I still have a virtual practice. Does that make sense?
Yeah. I was just curious because you mentioned something about ears and the kids and the lungs and how everything was all tied together.
Yes.
I have a bunch of friends who have kids who have issues, and I'm like,
Yeah.
oh, this stuff makes so much sense. But yeah.
Yeah. I mean, I'm what's it called? We'll see where it goes. Like when a doctor starts a practice, he has the Hippocratic oath, right? He takes an oath to. So one of the principles of our profession is the doctor's teacher, right? So I may not be able to take everyone as a patient, but if I can dispel knowledge and get people to empower them of how to be healthy, then I feel that I'm doing something that is fulfilling. I'm fulfilling what I should do, because I think we're having a crisis in general in Canada. Like just people, right? Like people don't have enough practitioners, and so I'm aware of that. But we'll see. Where it all goes. Like if the non-for-profit, if I'm able to, I don't know, I have some volunteers that we help together. We organize something. We are, coming together, making like a small home clinic, on the farm. Like if we get that up and running or something like that, and maybe I could do something once a week or something like that. But like it's still a long way away, especially with all the other responsibilities. Yeah. But teaching has a good place. There's a lot people can do with this knowledge. We're basically focusing on acute conditions, right? I mean, homeopathy too could be chronic conditions. This is an ocean. This is an ocean of knowledge. Like right now, we're going to be talking about some remedies. You'll see how much depth it goes into. And those in the acute phase, you decide for certain symptoms, and then you can prescribe the right remedy. And when you prescribe the right remedy, you could have a child hours crying, and I've seen this myself. I had crying with some ear infection or something. Mom doesn't know, picking her up, walking around, bawling her eyes out, screaming. As soon as she sits down, the child goes great. Turn the fan on, going outside for driving around the car. All types of things, and then you just find the right remedy. One little, you can just mix it in water. Just put your finger in it, put it in the baby's mouth, and within 3 minutes, hours of just stopped. The right acute remedy, they're miracles. They're miracles. They work so well. So in the acute phase, you guys could do a lot. If you really are interested in this topic and you say, I want to know how to do stuff, then like I'll show you. So the books that are going around, right? Have anyone take a look at that? One is called The Desktop Guide, right? This is by a medical doctor. His name's Roger Morrison. He's a medical doctor. The biggest advocates for homeopathy are actually medical doctors who were very frustrated with their own professions and didn't find things to help people with, didn't have all the tools. So they studied homeopathy and started trying it out and just found, empirically, evidence-based, that's working so well. So Roger Morrison is one of those people, and he wrote this manual. And it basically goes through all the main remedies that you would know and gives them the picture. Like we're going to cover pictures today. We're going to try to cover all of these remedies. But the picture, once you know it, then as soon as you see it, you can match it. And then that is it's the most effective treatment once you have a right match. Does anyone remember what the match is? When like cures like, what you're looking for, a matched remedy? It starts with S. What is it? Simile. Or it's called similimum. I said, similimum.
I couldn't spell it.
Yeah, but
I remember that.
I'm a doctor, okay? You don't ask me about spelling or my writing, okay? So the similimum is the right match, the similar symptoms. So homeopathy, this is the nice thing about these remedies. If you look at these books, the Desktop Guide, and there's many books like this, okay? Many books. This is just one very popular one. It's called by Roger Morrison, Desktop Guide. You can basically go through it, flip through, and it'll. Who has the book now?
I do.
Yeah, and so and now you can have a lot online. You can actually find these books online. You can download them in apps, right? So
Find it on Audible.
what was that?
I said you probably find it on Audible.
Oh, okay, yes, you can find Audible, but you won't be able to search the Audible. You want a book where you can say, oh, what's the symptom? Oh, it's right ear pain, crying child, right ear pain. It has like a hot cheek, a lot of mucus, right? You look up these symptoms, and then it'll pop up some matches, and then you go through the remedies. Okay? So you want it to be searchable, you want it to be in like a physical form or something you can read. So audiobook won't work. So that's like the Desktop Guide. Then there's something called a materia. So the Desktop Guide is one type of a materia medica. Okay? It's another word. Materia medica. Okay, it means a list from alphabetical order of the different homeopathics. Okay, so there's another book here. I think that's it. Yeah, Materia Medica. You'll see that.
What's this one?
No, that is a repertory.
Oh.
I will explain that at the end. Okay, so the Materia Medica is basically, or like one example is the Desktop Guide. Materia Medica are basically list of all the different remedies and what their main symptoms are and what their picture is. And sometimes you'll see certain symptoms are in bold. Okay, so let's say concussion with no desire to move, right? Like that was arnica. That might be. It's called a keynote symptom. Okay, so those keynotes are from these Materia Medica books, and they'll write them in bold, or sometimes they'll underline them. Okay, the other book that you have here is our repertory. All right, so let me pick one up and I'll show. So the repertory. I think you guys have seen this, right? So the repertories are basically in the side they'll have like symptoms, right? And it's like indent, right? So one of those symptoms is chest, and one of them is fever. One of them is vision. One of them is nose, right? So here in these repertory books, you're having, let's say, a toothache, right? So you can go to teeth, right? Go to teeth, and then you open it up, and it'll say teeth, abscess, teeth, bleeding, teeth, caries, which are caries. What's a carie? Who knows what a carie is? Carie is the old word for cavity.
Oh.
Yeah. So there's another book. I should probably bring that one too. They're called so this is homeopathy. It's old. There's older books that are there. So they use ancient words for things. So there's books you can get for not knowing what that word is, and then it'll give you the modern word. So carie is the old word for cavity, and I think there's a word for like I forget. There's some funny words. I think. Let me think of another example. If I run into another example, I'll tell you. But so there's dictionaries for these things. Teeth, discolored. Teeth, edges. Teeth, edge. Teeth. Okay, edges, and then it goes into like what happens with the edge. Okay, so like they feel sharp or they hurt the gums. Okay, there's very specific symptoms. Okay, so what happens is you can look up your symptom, and it'll get in that symptom. It has different remedies listed, right? So I'm going to pass this around. You'll have different remedies that are listed under something. Let's say pain, teeth, pain. All right? And then it'll have a number of listed remedies. Aconite, arnica, meteorinum, different remedies. So what you do is you take that teeth, pain, and look at the remedies, and you write the name of those remedies. Then you look at another symptom. So you had, let's say, a teeth pain, and then you also had insomnia. So you would go to I think it probably goes to mind. Let's see here. It'll go to okay. Sleep. There's actually a section on sleep. So you'll go straight to sleep. Okay, let me flip to it. So here's sleep. And then you have sleep, dreams, disturbed. And then it'll go into what kind of disturbance, right? Disturbed, dreams, disturbed, anger, dreams, anxious, okay? So you take your symptom, teeth, pain, afternoon, and you find let's say there's 5 remedies there. Then you go to dreams, sleep, anxious, and you have 15 remedies there. And then you go to a third symptom, whatever symptoms are important at the time, and then you look at the remedies that are in each of the categories and see which one overlaps. When you see the overlap, you're like, oh, that must be the remedy. And then you go to a materia medica and you look through that remedy and say, let's see if it's a match. It's a long process, but this is the traditional process of how to find remedies. Now today, it's good. The reason I'm telling you this is so you understand the process. Today, you can do a little bit of this through Google searching. But it's good to know. It's good. I'm teaching you a little bit of the process so you know what you're doing. So even if you're doing the shortcut, it's still good to know what the original process is. So let me pass this around. This is the material. This is the repertory. It's how you figure out the symptoms and you go to what the remedies are. People went through the entire materia medica and they found all the symptoms that certain remedies had, and they did all the work of categorizing them. It's a lot of work, yeah? Here you go. Okay. So did you, are you finished up now?
Yeah, just kind of looking at it. What are these names? Is it the name of like the process to cure?
These are the remedies names.
Yeah, that's not it.
Yeah, these are the
Okay.
remedies, and then if you look at, I'll put
Yeah.
it in the front for everybody, so it's a good question. So here is a materia medica. All right? So this materia medica is basically the opposite of the repertory. Let's say you looked up arnica. So you could go to the index and look up, like you saw the name arnica, and it'll tell you, oh, that's on page, oh, it's not in this book. Okay, it should be. It's a pretty common remedy. Oh, here it is. Yeah, 142. So it's on page 142. So then you just flip to 142, and then it'll tell you about the remedy. Now, yesterday you read of some of the main symptoms of the arnica remedy yesterday, right? You guys remember we talked about it? Now this is it'll give you almost like a monograph, right? It'll give you a monograph of the remedy. The arnica patient is morose. Who knows what morose means? Okay, another old word, huh? Yeah, it's an old word. So I'm familiar because I've been reading these books. Yeah, it's an old word for feelings. Yeah, kind of that. He wants to be left alone, does not want to be talked to, does not want to be approached. So they're basically going to talk you through the remedies. They're going to paint a picture of the remedy. Okay? And then that's how you understand the kind of the general feel of the remedy. This is my favorite pastime. Once you're obsessed, once you're obsessed with remedies, you just sit around and you just read the personality types. You just sit around and read like, oh, that person likes to have cheese at 3:00 every single day, right? Yeah, this is just like this thing. They crave some type of fatty, substance, ice cream, and it'll all be, and that's a unique symptom. And they have this personality that like craves something. Yes, So you're getting what happens is you start understanding personalities. You start feeling what it is like to be in the shoes of this person. So it's a very fun thing to do, and that's from the materia medica. And then the repertory is the opposite. You go to the symptom first, and then you find the. Does that make sense to people? Okay, I'm going to pass it around.
Similar to the prescription book that I have. One side is the description of the meds and the other side is the symptoms.
Oh, that's how did you do this already?
I'm just starting to.
Oh, okay. If you have any questions over there, you can ask them. I'm taking them on here, just on Patreon. Just type them and I'll try to answer them. They're on the Patreon. There's a link, the Patreon link. So feel free to ask them there. But that's how homeopathy works. Now, last week we ended up talking about some theories and some of the theory and practical aspects too. Before we move on, any questions from that side? Because if you don't have questions, then I'm going to quiz you. So better you ask.
Alright, so you can do the perfect murder with this.
Perfect murder?
Yes.
Oh, okay, wow, yeah, go ahead.
Okay, so take some oakweed, it's a poisonous berry, and you dilute it to 30 times,
Okay.
30 to 100 doses.
Yeah,
It's untraceable at that point,
okay.
and you feed it to somebody. There's no evidence of what killed them.
No evidence that?
There's no evidence of the pokeberry that was used for poison.
Yes, okay.
So you can kill someone and it's not be traceable.
Who said it would kill? Do you think the homeopathic remedy would kill?
Yes.
Why would the homeopathic remedy
You
kill?
use poison.
The poison, sure, there's lots of remedies made from poison.
Right, but I'm just saying if you dilute it down enough, there's no traceability as to what the person died from.
No, there's no traceability of molecules, true.
Right.
But your claim is that it could kill somebody. Why would that not happen?
Why, well, if it'll kill you, why won't it kill you?
Why wouldn't it kill you? Because, okay, so death or serious molecular effects happen because of the molecules in substances. Is homeopathy a molecular reaction?
No.
It's not, it's an energetic reaction. And that's why it's so safe. Because if you take a homeopathic remedy, even that's made from a poison, there's no poison in it. And number two, it's the way it displays won't display as the molecules affecting you. The molecules will poison and kill you. The energetic effect will be completely unique to the poison. For example, belladonna. Belladonna? Yeah, that's.
That they used like one of the plates killed somebody, didn't it, kill like Shakespeare or something?
Oh, that's you're talking about. I know you're talking about. You're talking about.
Is it Romeo and Juliet that they killed?
Yeah. I know
Are
you.
they
For example,
poison?
hey, witch hazel. Witch hazel? No, not witch hazel.
I can't remember.
No.
I'll Google. What's the Romeo-
Huh? You're thinking about yeah. So there's lots of poisons. There's even medicine made from venom. There's a medicine made from snake venom from the king cobra. It's called lachesis. Now, any remedy tell me, I'm going to remember an old patient of mine. I went one time, so I told you I used to treat these very people in fancy places in their big castles, and they're I met this one lady, and she I went to her home, and when she greeted me, right, I walked in, and she was like all coiled up, right, very mysterious, and then I'm talking about the case, and it turns out she is she can't sleep. She has some sleep problems, serious sleep problems, and she says, "It's as if I can sense everything around me. Even when I'm sleeping, I just feel everything. Even when my eyes are shut, I have a sense of things around me." And then she's very angry, and she has an interesting way about her where you actually feel. Have you ever been around people who they have like this power to kind of reverse the situation on you, and everyone could be laughing or something, and then they could just target someone, and suddenly like you become the joke, and then they can take it back. Oh, I was just joking, right? There are people. Yes, yeah. There could be some narcissist personality there, right? But have you met people who are, there's jovial and fun people who make everyone feel comfortable. There's those who you feel somewhat threatened by because they have a sharp tongue. Okay, she was one of those. Doing the interview all day, and I noticed another interesting thing. She had a very large, open neck in her. So by this time, I had already kind of shortlisted some of my remedies. So I asked, I was like, "Hey, why do you wear clothes that are so loose?" And she said, "Oh, I can't stand anything around my neck. Nothing. It has to be completely open." Okay, well, if you look up the lachesis remedy. Lachesis is the venom of the king cobra. It manifests not in death when you take it. It manifests as a remedy that's useful for neck problems, because the person is, how do you kill a snake? You hold it by its neck, right? So they're very allergic. They're very sensitive to things. You'll never find one wearing a turtleneck, right? They have How do snakes sense their environment? Do they have good eyesight? No, it's through vibrations, right? And they have other sense. So you'll see in these books, if you look up this in the Materia Medica, you will look up mind clairvoyance. That's how it comes up. People who feel they have some type of sense of something around them that maybe they're not even visually seeing. So she had this sense. Their snakes are also have the dangerous animals have this, like this tack and ability to be threats, right? They're especially the venomous animals, right? So everything about her posture, the way she was, and her demeanor, that was the remedy for her sleep. She probably in for insomnia problems. So the remedy, if I gave her that remedy, it wouldn't result in that same thing as venom would result in. It would result in the energy of that substance. Make sense? Very interesting, right? The whole manifestation, it's a completely different picture. And that's what the Materia Medica is about. You look at those pictures and you'll see what they're like. But this is a separate, complete topic in homeopathy, in chronic case taking. So maybe we'll get there. Maybe we'll come out for a course on how to take chronic cases and how to solve those. Very fun.
Did you tell her that she was taking cobra venom?
You know what I do? The way I practice, I don't tell my patients anything. Because as soon as I do, patients go and start researching their remedies, and then they'll either come, oh my God, I learned this, and then they're kind of thinking about things, and it's like acts like a placebo.
Well, isn't it on the bottle?
Oh no, you can give, you can give people the bottle. You can or what I do is, the way I used to practice, like when I was over there, I end up carrying 700, 800 remedies with me. So I just had them with me, and I would order them, and I would just give them a small package with the pellets in them, and it would just be their name, how to take it, the date, expiry, all that stuff. That's just that. I would never give them the name, because as soon as you do, then either they start getting into like placebo. Oh, this is happening from that. This is happening because this, or they start contesting you like, hey, that's not me. I read this is for that's for allergies, and I came in for eczema. Don't worry. The doctor, I know what I'm doing. There's layers to these, so yeah. So that's how I practice, and that's why I like it. It's also shown me over the years the effect of these remedies, because when you're in the dark, they have no idea what's going on. Mm-hmm. So when they actually benefit, and then when I tell them, I usually tell them after maybe a month or two, because when their symptoms get better, I was like, I myself carry the. Do you know what I gave you? Yeah, I gave you the blood of a lion. And like, oh my God. Yeah. So. Okay, so this is the other book I thought, if you haven't seen it, it's another type of Materia Medica, but he really summarizes keynote symptoms. This is Roger Morrison's, right? Very famous book. He did a great job. He's a student of George Vithoulkas. He is one of the oldest practitioners who wrote many famous books on homeopathy. He's still alive. I think he's probably almost 100 years old now. He's probably in his 90s, I think. But he's like the legend, George Vithoulkas. And all the great students, I've met two of his George Vithoulkas students, all very seniors and, practicing in different parts of the world. Roger Morrison is definitely one of them. There's some others. So he practices, George Vithoulkas is in Greece. And he also teaches homeopathy, like a full-time program in homeopathy. You can sign up to, and then I think you have to go and spend some time taking cases on the island with him or something like that. Still alive. Legend. So this was a student, he actually studied with him, and I think he developed this book, and he basically attended all his lectures, and then documented all his little clinical pearls, and then made a book out of it. So this, the great thing about this book is like it's very concise, and then you can see the like the bolded areas are the symptoms that are really strong. So I'll pass this around too, and you can take a look here. You saw that one already? Yeah. Did you see this repertory already?
Yes.
Okay. So you can definitely can take a look at these books while I'm up here. And let's go. Any questions? So any questions before we go back to the remedies?
I'd like to see that one.
Oh, you haven't seen? Yeah. And can I actually? I'm gonna use that book for a few minutes.
I was just gonna ask, these are the remedies, right?
Yes.
Okay,
Yeah.
just curious.
Yep, that's how it is, exactly. Oh, I have a scribbly note here.
I didn't read it. I wanted to, but I didn't.
Yes, yes. Yeah. That's an old note. That's a really old, it's like probably 20 years old and 15 years old, okay. So let's review a little bit. What do you guys remember from your remedy arnica? Just say it out. Yeah.
It was like a trauma, so it could either be physical or emotional. Cause the emotional part was like, I remember the physical part, like with the injuries, bruising, and stuff like that.
Yep.
But then you had mentioned that it could also be an emotional, or mental trauma as well.
Yep. But what will their mental state be?
While you're left alone.
Yep. And what else?
Dazed.
Yep. Will they want to just, be coddled and just hold them and no? What would they want?
They don't want to be touched.
They don't want to be touched.
Yeah.
They want to be left alone. Right? Different state, right? Just hold me. Just want just to be, nope, that's not them. That's a different remedy. Okay. And what about if you were playing some sports and then you went to the next day you had another competition? Could you take an arnica for that? What would you do?
Your sore muscles.
Yep. You could do that and it would help your sore muscles. That's right. So that's a good way to use arnica. And I would recommend that you use, like if you, let's say, you went for swimming and the next day you have a hike, you went on a vacation, then you should take arnica 200. Am I right? No? Which dose should you take? 30 is a kind of a reasonable. Just trying to throw you off here. Let's see. Yeah, everyone's like, yes. All right, good. All right. So let's look at another one. Oh, good one. So we have, all right, Ignatia. We'll go clockwise. So Ignatia. Has anyone heard of Ignatia? Yes? What do you guys know it for?
It's a flower, is it not?
That's echinacea.
Oh, that's
Oh,
echinacea.
yeah, this is Ignatia. But you could, who has the Materia Medica?
Oh, there it is right there, Ignatia.
Yeah, open up, someone open the book to Ignatia. So we're looking at remedies, specifically acute remedies on how to solve acute problems and using homeopathic medicine.
Okay,
Ignatia, what does it say about Ignatia?
when we read your story,
Tell us what it says. Does it say anything where it's from?
ignition is frequently required and is especially suited to sensitive, delicate women and children, to hysterical women.
Do they have all these? They has the interesting. They have all this old vocabulary, right? So we have to compensate like what they mean and what they're saying.
Right. You will not cure the natural hysterics with agnesia, but you will cure those gentle, sensitive, fine-fibered, refined, highly educated, overwrought women in their nervous complaints.
Does it have anything about where it's from?
I feel like I'm watching Murdoch Mysteries.
See, these remedies, once you see, what happens is over time, you begin to have the ability to look at remedies and extract what's important and leave off some of what's like outdated, right? And so that's what I'm going to try to do here. Like I'm telling you, take notes from me, and I'll summarize some things. But what I was asking about the material, does it tell you where it's from? Because someone said it's a flower. Sometimes it tells you what this plant is, what the thing is. Okay. All right, no problem. So Ignatia, it is. I'm pretty sure it is a plant, but it's what it is a grief remedy. So when what they're talking about as hysteria, they're talking about someone who is basically really upset, weeping from some type of a shock that is. It's not a physical shock, it's a loss shock. Like I've lost a family member, I'm stressed about something that's very distressing in terms of emotionally attached. So that's what they're calling hysteria. So what I would, to summarize it for you, the best way to describe it is more grief. It's a grief remedy. So when let's say you have somebody in the family that a family member died and they're just not taking it really well, and they're really down. And I've given this to many people, and very down. They're just not bouncing out of it. They keep on reminiscing. Because of this, oftentimes their blood sugars won't be well. Yeah, because it's cortisol, right? It's stress. So you're eating, and they're getting sick by themselves because of the grief. Okay, they may be gaining weight. They can't sleep, right? They're having cravings. A dose of Ignatia can really, really help them get. What I hear is like, man, you gave me that remedy, and it was the first night since my so-and-so passed. I had a good night rest, and I just feel a little bit better. Like it helped me take an edge off. That's the remedy. That's the miracle, the amazing effect of the Ignatia remedy.
I think I spelled it right. It says it's from the Philippines and other parts of Southeast Asia.
Oh, Ignatia?
Yeah.
Ignatia.
Yes.
Oh, okay. And what is it? A plant?
Derived from the seeds of the, I'm not even gonna try, tree. A large.
Oh, it's a
plant-
tree.
Yeah, I guess. Native to the Philippines and other parts of Southeast Asia.
Oh, okay. Interesting. So it's so we're talking about Ignatia being used for grief, for disappointment, right? You can have grief also not from a loss of someone you love. It could be something you love. Oh my God, I didn't get that job. My heart was set on it, right? It's disappointment.
What happens if you were to take magnesia, but you didn't need it? Like if you were.
Very good question.
If you were given them all in one.
So the question is, what if you took Ignatia and you didn't need it? What would happen? What would you think? Yes. You would have a proving. Very good. Looks right. When you don't need a remedy and you take it,
Right.
then you begin to manifest a symptom, and that's how all these books were written. Because healthy people who started learning about homeopathy became like this craze. Hey, let's try that, and then they would go and they would dilute it and they would try it, and then they would make notes. We have their notes. That's how these notes came out. I tried this remedy on this night. I had this dream, and those dreams will actually manifest okay, dreams. This is another world. This is such a great thing to discuss. I love dream interpretation. So that's another thing I do in my practice, because the dreams. There's two types of dreams that I would say. Yeah, two main types of dreams. The one dream is basically your feelings manifest into an image. All right. So I have a dream that I'm falling from a cliff, right? Sometimes that can be driven from a feeling that you have accomplished something and you're going to lose it, and you're going to lose this position that you're in, and you're plummeting, all right? And it's a fear that, oh, I don't want to lose and fall from this great height that I'm on. The dream has manifested it into a image of you falling, and then that is a stressful nightmare, right? A person could be I was in medical school at the time when I was really in love with the Far East and traveling, and I wish I could just go. And I saw a dream where I was on a standing, putting bricks onto a wall, and I was just putting the bricks, and I looked over, and the wall just kept on going forever. So it was my mind showing me that I'm in a state where I'm feeling, when is this going to end? You know, I'm just doing things that I'm not enjoying, and I want to do something else. So the mind can oftentimes produce these images, and the images actually, you have to analyze it. It's just an emotion. It's a feeling that now is in a picture form, and it describes your emotions very clearly. So as a practitioner, oftentimes, especially in chronic health conditions, you can see the dreams are insights into the people's health. So they come in and say, okay, do you have any prominent dreams? And they're like, yeah, it was really I don't know what it means. Like, yeah, go ahead, just tell me. And then they'll describe it, and you can see the picture coming through. That's one type of dream. Other type of dreams, this is I think I am definitely I believe it, and there's enough documentation about it, but it's probably a controversial topic. I believe they're otherworldly messages. They're from the divine, and they are signals, and that's that is a world that is some of your emotions could be mixed into it, but they're messages from God. So those things, those are also clear when someone talks about them. Very religious person comes in, tells you their dream, then you can tell that that's not a dream from your emotion, that's something else. So those are two types of dreams. So I only focus on the emotional dreams. What we'll do is we'll take a break. So it looks like people want to go to the washroom, and we'll come back and we'll continue the release. So all these guys, if you want to ask questions, you can just come onto Patreon, and I think the link is available, and it's Mystic Medicine on Patreon, and then I'll answer your questions there, inshallah.
In all different strengths. This one is open, so we take on this one.
Okay.
So when you use them, turn upside down and then listen for one falling. And you can see it fell. And then pull it, you don't touch it, and just pop it in your mouth.
Well, it is small. They can't, so you see, there's like 80 or something in these.
You just turn upside down, twist it, and then you hear one fall, and you twist it.
So these
Yeah, the difference for you to fall and
are the remedies, oftentimes.
and you don't want to
They come in these little itsy bitsy. So this is arnica. One is 1M, that means 1,000, and this is 200. And so, usually you can pick that up at a health food store. And usually just twist it like this, and it gives you a pellet. Where's the histamine one?
Right here.
Oh, okay.
There's one
And
in-
so the
one that's got.
Oh, okay.
Well, run that, so yeah, maybe that's a good question. Well there.
And some of these there, this is like a
Yeah, so
histamine.
then that's a liquid, and it's in chocolate and
There's a
combination.
histamine.
So then you can see,
You just twist it, right? Just twist that. And then a couple pop down. You have a couple pellets in there,
three different things. and
a couple
shows you the
pellets,
strength.
and these pellets, whoops.
I just use my eye drops.
So if I was some of your store, recommend stuff, I have to come in and just say, I'm looking for,
We have a book,
Right.
there's someone, and then we have the pictures are under each one, that helps us too. And then most people know what they're looking for, but we can kind of help you.
And once it pops down, then you can
This is a
just put
tablet
them under your
form,
tongue.
and you can see the different, this is their big blend. Yeah, for women with menopause and that kind of thing.
And there's these other combination
These all
remedies.
are different strengths.
okay,
So the 30 seeds
And
are
it tells you
always
it's like it's
purple,
what it's
makes
for,
it easier.
dizziness.
oh, okay, yeah, that makes sense, color coding on your face.
Yeah. this is
And
the
then
most-
so we look at these, and then we look at the homeopathic that that our constitution is made, that is made of, and then you can use it. I'm gonna explain this in a few minutes. I'm gonna get a drink of water too. I'll be right back.
Yes. Just water,
So should I?
Water.
Can we get going? Because there's actually, because we only have this class and next class left, so I want to cover as much as we can, so we can leave you with, yeah? So we'll just power through, and I didn't give you guys a full 10 minutes break, but, all right, we're gonna continue then. So if you guys, came up, you'll see, Laura was so kind as to show us different remedies. These are combination remedies. Remember when we talked about combination remedies? Do you remember what a combination remedy was? Who remembers what a combination remedy was?
More
It's-
than one substance?
Yep. And that's a traditional way of using homeopathy, right? Wrong. My questions are always rigged. It's the model that is used for more acute symptoms. So you don't have to go through exact matching. If you're like, I think I saw dizziness or something like that. Yeah, vertigo. So the way this remedy works, okay? I'll know it even before I look at it. But and this is drops, right? It's not in pellet form, but you can see, for instance, yeah, I knew this would be there. Conium. It is a very common remedy for dizziness, but conium remedy, it's for a dizziness that has to do with someone who's very anxious, and they also have some problems on the sexual sphere, and they have some problems in their when they're worried about something. That's when they experience the vertigo, and when they lie down, they'll experience vertigo. But because if you don't have a homeopath and you don't know what to do, you could, if you went and got conium, it may not be a match. So some people will go and just go pick up a remedy like this, which has conium, it has a petroleum, it has ambergris, it has a bunch of different remedies that have vertigo and dizziness as their symptoms. So they bunch it together and they think perhaps one of these will be a match enough and it'll help your dizziness to some extent. Not a bad approach for someone who's not fully trained in homeopathy, safe. It's kind of a hit or miss a little bit, but you're covering a kind of a ground of some remedies that have to do with vertigo and vertigo and dizziness. So and sometimes it can help tremendously. Yes.
So, going back to the question I had for you,
Yes.
so if you take that and it's got a bunch of different ingredients in it,
Mm.
but those aren't the right ingredients.
Yes.
Will that not make you sick?
So the sick. When you say sick, what do you mean by sick?
Well, it's gonna give you some, you said the one was, what was it?
Arnica? No.
You said some of the stuff in there will,
The proving.
Like, you wonder if it'll make you dizzy.
no, some of those ingredients are going to fix other things.
Okay.
And they've combined it all into
Yes.
a dizzy medication.
Yes.
So let's say arnica's in there,
Okay.
and you took arnica, but you didn't need arnica, you needed the other
Conium.
ingredient.
Right.
So would the arnica then make you have, I know you don't like the word.
The symptom,
Symptoms of
arnica.
arnica when you
Yes.
didn't really need it.
Yes.
Okay.
So every remedy has though major symptoms and then there's minor symptoms. Okay? So some symptoms are not the main symptom of the remedy, but they're confirming factors. So for example, arnica is mainly a bruising, a remedy for a concussion, for a harsh trauma. But then it also has, and then there's some other things that has, and you'll see those in the book, right? A desire to be left alone, better from cold. All right. Now, if your main symptom is the bruising, and you take arnica, then this other confirmatory symptoms are not such a big deal. If you took the remedy and you didn't have bruising, right, you might feel a bruised sensation. But if you felt to be left alone or not left alone, that's not something that's such a major symptom that would actually cause any trouble. Do you understand? So the remedies are basically, they have a main symptom, a main organ they're kind of manifesting, and the other symptoms are more for confirmation. So let's say you took dizziness remedies. The main symptom of that remedy is dizziness and vertigo. So in other symptoms that it has are for like maybe confirmation, or they're side symptoms. They may feel, let's say another thing, they want to be left alone. All right. So if you had a dizziness issue and you took the remedy and it wasn't the exact type of dizziness that you had, it wouldn't cure it, but it wouldn't really it wouldn't make that problem worse.
Okay.
However, the other symptom, okay, of being desired to be left alone, that may manifest, but it's not that big of a deal, because it's you're looking for the dizziness aspect. Does that make some sense? If you took the remedy and you didn't need it, and now you have a desire to be left alone that you didn't have before, that's the proving part of the remedy, but it's not. It's nothing dangerous or anything like.
Side effect.
Yeah, it's not dangerous side effects. It's just it's something that oftentimes manifests for the exact remedy match. For these, and another benefit for the combination remedies is they use very light doses. Because they know that people are doing it on their own, so they use very light doses, and then they take it multiple times, and that's how the symptoms are.
If someone is taking prescribed medication from a doctor for dizziness,
Yep.
and then you took homeopathy for dizziness, would it be hurt?
You shouldn't do that.
You shouldn't do that.
No, shouldn't do that. I recommend always like doing your things under someone's care. So if it's a serious problem and you're seeing a doctor, then everything you're taking you should tell him. And if he tells you don't take anything else, then don't do anything else. But if it's something that he says, look, I don't have anything else to do, you can go try something. I have nothing left. Then trying something before, like let's say it was not a serious problem. It's a sore muscle. You know, you can take something and then it's okay. If it got to a point where your muscles are always sore, you might be under some other problem that's happening. So let him diagnose this. Don't be taking homeopathics during that same time. If he gets to the point that, hey, you check out, I don't know why you get so sore. It's nothing. There's no medical emergency, and then you took it, then it's okay. But while treating, what it does, it can mess up one or other
Yeah.
treatment. Yeah,
So you don't mix the two.
yeah. You can. So that's called integrative medicine.
Right,
But there's practitioners who do that.
okay.
Like I do integrative medicine. Like someone comes in, I will give them antibiotics or anti-inflammatories till a certain point, and then at a certain other point, I'm going to give them this natural substance, or I'm going to give them these fish oils that help also decrease inflammation because I know how it works together. I won't go. This is all part of a fixed way of treatment,
Right.
but that's for someone who's trained in both.
Educated.
Yeah, or no, who knows how to do yeah, exactly. Okay, so don't do that on your own. No. This is for that's why we're doing acute remedies, things that are the common things that you can see that are safe to work with. And if they're not fixing and they're not, and you try a combination or you try the exact, then yeah, go to your doctor and then see what they do from there. Okay, so let's try to get through a couple more of these. Okay, aconite, right? And you see, it's also that they're all showing it as on the head, right? So arnica, they're showing arnica on the person's head is bumped, so they're using arnica. They're showing ignatia, and they're also showing aconite. So right, they're showing it as a head because arnica could be a bump on the head. So ways to trigger your memory, and then ignatia is kind of a shock, in the mental sphere, and the aconite is a shock in a different way, more to do with fear. So it says shock and fear. Now aconite is a remedy that is made. Aconite, actually, I think aconite is a poisonous plant, if I can remember. Let me get that Materia Medica. Where is that Materia Medica? Aconitum.
Poisonous from the buttercup.
Huh? Yeah, it is poisonous, right?
That monk shape of wolf.
Yeah, right. You looked it up,
Oh, I'm looking at it.
and it's poisonous, right?
It says relieve pain, help with cold or other reasons.
Oh no, I'm looking at where does it come from?
Buttercup plant, is that?
Yeah, but okay. So aconite is a remedy commonly used for shock and fear, but it has a particular symptom picture. All right, I've used aconite a lot for children with fevers. Okay, and when they get really scared, they're going to sleep and they have this this kind of their temperature's rising and they're scared. It's a very good remedy to bring the fever down.
Says it's native to mountainous rocky regions of Western and Central Europe, Asia, and North America.
Yeah. So there's this fear that happens, and it's like this anxiety and it happens. Aconite, the remedy, the symptom of the remedy is that if you ever seen someone when these kids are like playing around at 8 o'clock and at 8:15 their fever just spiked. It's like it's just a short period and suddenly their temperature changed very rapidly. Or you went outside and boom, I felt like a cold wind just hit me, and suddenly I know I'm getting sick. Have you ever had that? That's the picture of the aconite. That's when you use it, where something happens suddenly, a cold manifests suddenly, and then the fever rose suddenly. Very good place to use that remedy.
A hot head with a cold body.
It could. Let me think. That sounds like belladonna. Is that what it says?
That's what it says under our
Aconite?
Montana.
Arnica. I'm asking about aconite. Aconite.
It says it's the queen of poisons. The plant is extremely poisonous.
Yes.
It is aconitine, a potential neurotoxin that
Yeah.
attacks the heart and nervous system. Ooh.
Right, see?
Because its deadly nature has been heavily featured in folklore, mythology, and even Shakespearean literature.
Oh, is that the one? That's the one. Yeah.
Thank you, I'm not crazy.
Aquanite.
That we all know.
ACONITE.
Okay, so yeah, it can also be used as anything that's really violent and that's caused someone to become ill because of the violent earthquake or a car accident, right? They're just scared from it. There's a lot of restlessness. There's claustrophobia. There's shock and fear. Another very interesting symptom is they could be very thirsty, and they want something cold to drink. Right. So it's a unique symptom. It's a unique symptom. Very different, you see, than arnica. They may have dark urine because they haven't drank. Because when you're stressed, your body's heating up, and your urine is dark, or you're having much urine production. It can be for yeah.
I have a grandson who will have no fever, and boom, his fever is 41.
Right. Yeah.
So this would be.
So yeah, but you have to check if he's real chill and he's his urine's not dark and he's still playing around,
No.
then it's okay. But if he's hold me and and he's waking up,
Yeah.
right? That's one sign. Oh, he's and he's just shooting up. You'll see within minutes his fever will come down, and he'll go to sleep.
Because they can't get it down.
Yeah, that's right. Oh, parents love you for this stuff. Parents love because you're doing something that no one can do. You're not giving any medicine, any of drugs that even though they take time to have an effect. So the right remedy will it works so wonderfully. Yeah, all my children I have 4 children, and we've been using this stuff for in their combined age of my family, with everyone's age. I think we're probably talking 50 years or more, maybe 60 years plus, if they're without need of antibiotics or without use of any harsh chemical drugs, because these natural remedies can do it all if you catch it nice and early.
Yeah.
Okay, next remedy. Hypericum. Hypericum perforatum. What a wonderful remedy, hypericum. I'm trying to give you the stuff that's you can kind of keep it as a high, underline it or put it in bold or circle it. So you remember it for one thing, and then you can use it for other things once you look at the Materia Medica. So it says for blows to the head, spine, or coccyx. This is the end of the spinal cord, the very bottom. The end of the spinal cord, at the very bottom, is a coccyx. Okay, so you have a hit there. It's okay. So a whiplash or slipped disc. That's where the picture is showing. So I'll tell you now that's the picture that's showing. That's what it says, and I'll tell you from my experience what it's for. It's for nerve pain problems. Yes. So hypericum is the remedy that's used for this. You can get hit in the spine or hit in the coccyx or something, but what it produces is this sharp nerve pain. Oh, ouch! What was that? Oh, I just kind of was in the wrong position. It's like a nail just hurt me. Oh, ouch! Hypericum. It's that nail-like nerve pain that hypericum is very good for. So it's injuries to the nerves, into the spine, and pain after dental procedures. You've gone to and my teeth are so sore, and every time I chew something or something cold and it feels like a sharp pain. Hypericum. That's the remedy for it.
St. John's wort.
Yes, Hypericum perforatum is St. John's wort. That's right. Yes. And in regular St. John's wort is used for depression, mild to moderate depression. But it's working at the neurological level, and its manifestation in the homeopathic sense is hypericum as a neurological a remedy that brings down sharp nerve pain.
It says that it can help with menopause too.
Yeah, so that's a different, okay. So I wouldn't use hypericum, the homeopathic remedy for menopause like that. I'm trying to give you things that are good for acute symptoms. As soon as you get into menopause and now into more chronic things, it's a little bit more complicated. Okay, and hope next, for instance, like if you, next course, I can talk about how, like something about hormones and how some of the herbs work. That would be, you would need to understand a little bit of that before you just start taking, just herbs even for menopause. All right, and then we'll go to, next one is symphytum. And I think symphytum is pointing to the eye, I think. So this picture is pointing to the eye. I've also used it for people who've had like just blunt injury to certain places, but they have a symptom associated with it. Basically, I use it for people with like a fracture, like a broken arm, but you can use it for anywhere that you want to improve the healing, the healing to a limb, healing to like a socket and around the socket, and it's a blunt trauma, but it has something. It benefits specifically eye trauma. So I don't know. Someone goes to a bar and gets into a fight and gets to come home with a blue eye, right?
Does it help the black eye?
Yeah, help the
It
black.
does?
Yep. Yeah. It'll even help you like with the fracture itself. If you know how someone who's not their bone is, it's not healing fast enough, symphytum is a good remedy for that.
Is that like when I had asked you, like, what's the difference, if
Yep.
you go, I can't remember it, but if you go to the doctor versus whatever else, right?
Yeah. So if you go to the doctor, he'll put the cast on it, but it still might take 6 weeks.
Well,
If
yeah.
you give symphytum,
Yeah.
then he might be having bone pain, and you give one remedy, and he says, "Oh, it's a little bit better. I don't think I need the aspirin." And maybe 2 days later, he says, "Oh, my bone pain is returning." Okay, and then we give into the symphytum. Oh, it's kind of come down. So now your 6 weeks could be turning into 3 weeks. It's helped bone fuse better.
Is it for, like, you use it for a bone bruise too, or would that be more arnica?
Bone bruise.
Like deep into the marrow? Like trauma deep into the bones?
Yeah, you could use symphytum for that. Arnica is more for the muscle.
Okay,
So symphytum, you could say it's more for the bone. Yes.
okay.
And hypericum is more for the nerve, or where the nerves are coming from, which is the spine. Okay? And then they have a little interesting thing here, another little blurb it. So it says aconite can also be used to relieve pain in eye injuries, and so, but it's a different type of relief. Can you see the difference between symphytum and aconite for eye injuries? What would you think the difference is?
Would that might be like you got something in your eye, or like some sort of an infection versus like?
Yes.
face-to-face?
It's for conjunctivitis. So it's an eye that's an eye pain that's more from that's an inflamed eye, not from an injury of an eye. All right.
Pink eye?
Conjunctivitis can be pink eye, but it's you could it depends if it's like, so if it's inflamed, and again they have anxiety, right? If they have fear, something that got stuck in there, true. So, and especially if it happens suddenly or something, and there's like a shock or fear associated with it. The mental picture is very important in homeopathy. Okay, we're good. Okay. Okay, and then again, we're still at the head. So I like this picture because it helps, if you keep this on your fridge or whatever, or somewhere in your cabinet where it's kind of lumping things together. So you can consider the following remedies when you're looking at the head or the eye, okay? So here it's talking about eye strain. What remedy is it saying for eye strain? Ruta. Yes. So ruta is another herb. It actually grows wild. You can see it. We can catch it when you go out here. You can see it growing out there. And it's for it's a type of kind of a strain that happens to some of your ligaments. It's also useful for wrist problems. In the eyes, though, however, it's some type of a injury to the tendons around your so it says eye strain, general stiffness about the eyes, which is caused by and worse from exerting the vision. So especially doing fine work, such as needlepoint or a watch repair or reading fine print. So basically, your muscles in the eye are also they also help to keep your focus, and all those could be being strained. So this is for the tendons and the ligaments in areas. So in the eyes, the problem that's happening in the eyes is not just it's not an injury, it's not a blunt trauma, it's not inflammation, it's now the tendons. You understand? Every area, every herb, every remedy has its own area of focus. This is on the tendons and the ligaments. So that same way, it's going to come later on. You'll see the Ruta remedy. It'll be happening for wrist pain. Okay, so now let's go down a little bit further, and now, it's showing a fractured arm, and it's showing some main remedies for that too. Two remedies we already studied: arnica and symphytum. Now, arnica. When would arnica be used if, let's say, you got an arm injury?
Right away.
You could use it right away, for sure. But what kind of arm injury would it be that would be that if you used it for?
Sprain,
Huh?
fracture or sprain.
For arnica?
Trauma.
A blunt trauma, yeah. But for the musculature, you have a bruise. The symphytum would be used for the bone to be repaired. You okay? And you could go, for example, the Laura store. They might have a combination for a like an injury like that, like a fracture remedy. They might have one. I don't know if they do. I don't use many combination remedies, so I don't know. But if they what was that?
We don't have a lot of combos, most of them are individual.
Okay. So, but that's one way they could have that, and they could combine arnica, symphytum, because arnica is dealing with inflammation, symphytum is dealing with the bone, and there's another remedy called ledum. Ledum is another one that is for trauma. So I'll read you a little bit about ledum. All right, it's for venous congestion. So when there's edema or like puffiness, okay, and hemorrhage in an area, so and it feels better again by cold, and but there's congestion in the area. So oftentimes what happens with inflammation? Swells. Yeah, swells. So this is for swelling.
That might be like more the bone bruise then, right?
For maybe, yeah.
Pressure
Yeah.
and-
Yeah.
Okay.
So ledum it's also ledum is also used for bug bites, for when you get a bite from an insect, like something that like has a bee or something is swelling, and then you can use ledum for that too. It's just congestion, like the blood is not flowing out. So this combination, for instance, if I was called by a big company like this, Boyaron or something, and said, Dr. Rehan, can you make us a fracture remedy? I was like, yeah, sure. Put a little bit of arnica in it, put a little bit of symphytum, maybe 30C, and put ledum in it. And those three things together will help to repair bone, decrease inflammation, and get the congestion going. See? That's how you make a combination. Okay, so Yep.
Does any of the remedies, when put together, have sort of counter reactions?
They do.
They do.
They do. Yes. So it's good to like. I'm not telling you to make these remedies yourself, right? I'm just telling you how I might do it because I have some training in it. But for average people, like yeah, you can remedies that are already combined, made by people. Yeah, the companies have made them. They've done the research. Okay. All right, let's see here. Okay. Oh yeah, Epicac. You have? What do you know about it?
Does it make people vomit?
Epicac is used for exactly that, but it's not used to make people vomit. What do you think it might be used for? Huh?
Make them stop.
Yeah.
Make them stop vomiting, okay.
Because sometimes the original substance might do something, but the homeopathic remedy does it doesn't do the like it doesn't cause you to vomit. It's used for helping you from vomiting.
So what happened to like,
What was that?
so, would it?
Like here's like, yeah.
Yeah, so, would it not make you, like, puke?
You're not vomiting away. but
Yeah,
you're
so it
vomiting.
would take you over the limit. If you took this,
If you
you'd
didn't,
make someone throw up with this. So if you had food poisoning or something like that, you thought of, or they took some pills, you wanted out of them, you could try to feed this to them to make them throw up?
no. This is for people who have nausea and vomiting. For instance, nausea, vomiting, and pregnancy, or I'm feeling like I need to vomit, and and you want to like, oh really? Why do you feel that way?
What he's saying though is that you had somebody
Like,
come in
push
that,
it, or,
somebody came in that had taken some pills that they shouldn't have been taking, you could give them that.
No, you would give that would Epicac can be used as in its original substance, in its I believe Epicac is a herbal substance that makes you vomit. But the homeopathic is used for people who have a sensation of of vomiting. So it actually helps cure it.
Carsick,
What was that?
Carsick?
Carsick. I think that would be a different remedy, but this one is a constant nausea, which is incapacitating. A stomach seems to hang loose inside. The nausea is unrelieved by vomiting. So even after you vomit, you still feel like vomiting. And they can have a migraine. They can have a nosebleed. Their face is flushed. It's basically a remedy for anti-nausea and vomiting. All right. Food poisoning. Next is a remedy called arsenicum album. Now, for instance, you guys can, like if you type on Google, food poisoning remedies, homeopathic remedies, they'll list things just like I'm listing right now. This is a very basic version, but they'll go through different types of remedies that are similar. They'll go through arsenicum, but then they might go through some others as well. So now what's arsenicum? It's actually arsenic. Yep, and that's poisonous, right? So arsenicum is basically it's used a lot. It's basically for relief of poisoning. Yeah. Yeah, it's for food poisoning. You can use it for food poisoning. The person has had some bad meat or something, and they're feeling kind of sick. They're feeling what did I eat? They're feeling anxious also. You can give them arsenicum and help them calm. These are very useful remedies to have around.
So it's not like overindulgence, it's actually like,
What was that?
it's not overindulgence, it's actually just like yucky food.
Yeah, it's something that made you sick.
Okay,
Yeah.
If you have food poisoning, you know it.
yeah, oh
Yep,
Trying to
yeah,
get
yeah.
differentiation.
And it's such a horrible feeling, and you give this, you'll recover faster out
I'm
of
gonna
it.
go buy some.
Yep, and they
Just
also,
in case,
what was that?
just in case.
Yeah, yeah, and like again, I know there's homeopathics that have expiry date and stuff, but whoops, they also almost need Arnica. They don't really expire like that, like it's I know they have the right expiry dates on them, and but I've used my like I've used my homeopathics past those dates too. It's nothing really unsafe about it, but if you want to be safe, then yeah, just buy.
Maybe diminished
Yeah, maybe diminish. Yeah,
a bit.
yeah, could be. So arsenicum. So arsenicum. So now this person's feeling sick in their stomach, right? If they're feeling nauseous and they're vomiting and they don't want to, you can give them ipecac. If they vomited and they're still feeling, I don't know what's going on with me. I think we got that rotten chicken at that, cheap restaurant. Arsenicum, and they're like, they're so restless they can't even get over it. Okay, next remedy. We have yes, carbo veg. Yeah, carbo veg is a very interesting remedy actually. Yeah, and it's a remedy they're saying it's not just any food poisoning, but it's going to be from fish. Let's check the book here too. You see how fun it is if you just start why is it an ocean? Because each symptom there's so much to it, so you can actually go through and you get more and more familiar with these remedies, and then you can never know enough. And in some parts of the world, they actually make their students like memorize this materia medica. You can see that? Yeah. I mean, for my study, we had to memorize a certain number of remedies, and then you had to be able to go through them. It's hard to remember all of them, but you get familiar. But some of them start from a very early age, just I'm going to dedicate my son. He's got to be a really good homeopath, and they're able to cross reference and. Yes, so this type of food poisoning has a very interesting symptom that they feel air hunger. Yeah, they can't breathe right. It's air hunger. They feel like they're fainting. There's indigestion going on. That could happen from various reasons. That could be from a sunstroke even. That could be from eating bad. That could be from an infection. There could be sick. But as soon as they have this air hunger, this fainting, it's a different ipecac. You're vomiting. It's like you're vomiting and it's a strong vomit. The carbo veg vomit or the sickness is a weakness, and they're falling over, and they're cold, and they don't want to be cold, but they don't want to be covered either. They just can't get relief. There's a lot of bloating, burping. Can't get it out, right? This is the carbo veg picture. And carbo veg, this patient also becomes very negative, actually. They're in a very grouchy mood because, which is not so apparent with the ipecac, but this one is more prominent. The arsenicum has more anxiety and restlessness. Okay, so the carbo veg is more slumping over, negative, feeling very uncomfortable, needs air, fan me. Okay? And let's do okay. Let me pause this for a few minutes, and let me talk a little bit about these remedies that they did. So you guys saw all these remedies, right? Did you guys see how to open them? Right? They you're able to twist these, and then a little pellet pops out. Did everyone get a chance to come see this? Okay, so Laura brought some homeopathic remedies from her store. This is what they look like, and you can see it says Arnica 6CH, and then this is Arnica 30CH, right? So the 6 is stronger than the 30, right? No? You're right. 30 stronger. Because it's more diluted. So if you had a 6 and you wanted to get into a faster effect, what could you do to get to kind of a stronger effect? More frequently. Good. You guys are catching up. Yeah. Anyone not following this stuff? If you like, I want you to feel comfortable. You know, it's only 4 sessions, but you should be able to like now go to the store and say, oh, I know how to use this, and frequency matters, and light doses this much, and right. So
taking 2 or 3 or 4 doesn't change nothing.
Doesn't.
It's the frequency.
Yep. And honestly, sometimes I just give my children like just 2 pellets or 1 pellet. It's okay. With a child who may not even be able to just put it on the tongue, under the tongue, and like it'll dissolve, right? But a child may not even know how to do that. But you put it in a glass of water, let it dissolve a little bit, and just clean your finger. But put your finger in and put it in the mouth. Right? Take a spoonful. Okay. And some of you did an experiment. She brought in an open bottle of histaminum. Any idea what this is?
For allergies?
Yeah. Is that what you guys use it for? So histamine, what is histamine? Yeah, where does histamine come from? Anyone know?
It's like your body.
Huh?
Your body produces histamine.
Your body produces histamine. You know where it produces histamine? Histamine is produced in mast cells. So there's cells in the body that are called mast cells, M-A-S-T, and they have histamine inside them, and outside they have immune sensitive markers that as soon as they get triggered, they release their histamine. Okay? So histamine is that molecule that reacts to the areas around it by increasing the amount of inflammation and blood flow, and brings puffiness and redness to that area. Oftentimes up here. So antihistamines block histamine. Okay. Now, here's the spectrum of how we can understand this. Antihistamines block histamine. Right? In natural medicine, there's things that can stabilize the mast cell. Do you know what that would be?
Probably that.
Huh?
That right there.
What was that? No, it's not that. So there's substances. What they do is they strengthen the barrier in the mast cell's outer membrane, and so that the membrane is less reactive and won't release its histamine. That's called a mast cell stabilizer. So in our course, probably after this, we're going to study things like that, and we'll explain the biochemistry. And one of the supplements that's used, that it can be used, that does that, is called quercetin. You might have seen quercetin. You probably have quercetin at your store. Quer. Yes. Quercetin. Quercetin is a mast cell stabilizer. So it's used like similar to antihistamines, but it's solving problems at a more root level. It's instead of the histamine getting out, and then you have to block it from, it's already out there, it's floating around, and you're just kind of blocking it. You say, hey, why is your mast cell so reactive? It's stabilizing the mast cell. Okay, that's how quercetin works. Now, histamine, this is a homeopathic, which is I would not know. We don't know how it's working. We don't know what the molecules of this is, but it's probably made. It's probably a dilution. I have to research this guy because this is. I'm not. I haven't read. I've not used much of this remedy, but it's probably a dilution of histamine itself, and so it's looking at how histamine reacts in the body, and someone who has a high sensitivity of using histamine, this will alter how their histamine is acting. Their body's reacting to this histamine. So they're all working at 3 different levels. Very cool.
I'm just curious.
Yep.
But you said the body makes it, right?
Yes?
Then where do they get the dilution?
So they'll take, so histamine is a molecule. They'll probably take that, they'll extract this histamine and then they'll dilute it and then they'll make it.
Really?
Yep. You can do that for, just like venom, just like blood, just like, yeah. Just like that. And so what we did was, if you're interested, if you have allergy symptoms, Laura said you can go ahead and just pop one of these in your mouth, just let it dissolve, and see if they improve. Just, might last a couple hours. If you do not, you can still try it. What will happen? You might get a feel of the still stuffy nose. It's a good experiment. It's fun. If you like, no pressure. But it's fun. That's how I do this all the time. I've actually done this with lots of remedies. Yeah, it's an experience. Okay. So, and then there are these combinations, and I think we talked about these already, right? Yeah. Okay. All right. So can we power through a few more? It looks like people getting a little tired. I know, but it's like getting to know remedies. It is a little bit grueling, but you have to. The more you talk about it, the more familiar you're going to get. All right. So we're going to go to. Let's quiz each other. Actually, let's do that. And tomorrow, last class. Does anyone have any acute problem that they would like to present? Well, we can do it, or I can act. I just wanted to see if we could see some of the remedies. I want to see if I can help you guys solve something. Does anyone have anything that they would like me to Yes.
Sure.
But it shouldn't. It won't be a chronic problem. Something acute. So we can kind of among these problems, the class can kind of see how an acute remedy can be
I'll run it
found.
by you at the end and see if it works.
Yeah.
At the end of today, and then you can tell me if it's a good one.
Oh, okay. Sure.
How about very loud snoring?
Chronic problem. Yeah, and that will probably not just we won't go just into snoring. We'll go into many symptoms. Yeah, a person because it'll be constitutional. It'll be a person trying to, they may have, other nuances about their personality, about their thing that will match, and then we have to repertorize. We have to look at the book. So this is a lot more. It's a lot deeper.
How about tennis elbow?
Tennis elbow. That's
Tennis
that.
elbow, go for his elbow.
Yeah, for example, that's it, and it happened. It happened through some type of a.
Physical or repetitive motion.
It happened like that. Okay, yeah, that could be. Yeah, so I'll actually listen to both of you at the end, and we'll see which one would be best, and then we can solve it. Right?
Is there a difference between dizziness versus head dizziness? Or is it obviously the same thing?
Disney versus head dizziness.
Yeah.
What do you mean?
Is it like the dizziness, is that like your body almost?
Okay,
Or
so
is it like more of a-
there's the difference between dizziness and vertigo, which one is that it feels like the world is moving.
Okay,
The other one is that it feels like your head is moving.
okay, oh,
Yeah.
okay, I see.
Yeah, it's just a subtle distinction, and I always confuse them as well. Okay. Right. Okay, so then after carbo-veg, it goes into a little dot on the person's leg, and it says apis and ledum. So apis is,
A bee.
yeah, that's right. Yeah, apis is made from the bee stinger.
It says the whole body online.
The whole body of the bee?
Yeah,
They took the whole bee?
that's what online Google says anyways. Who knows if that's accurate?
Okay. I thought it was just the stinger that they took, and then they basically they grinded it up and put it into a tincture, and they made it. Maybe it's the whole body. I'm not. It could be. Yeah.
Where are you making these tinctures? You make some yourself?
Me, I don't really make them. I actually buy them. It's just easier. But you could.
Like, is there a specific formula, like how much, so many grams of the, stones that you gotta use, or is it just?
Oh, for the mother tincture?
Yes.
I think they would probably use it as whatever is they use for standard extract in the mother tincture. For example, let's say you devil's claw. It's a plant that you use for pain and inflammation. So you have to have a certain amount in there to be able to use it on your pain point, and or calendula. If you want, it's for like a skin problem, right, or a burn, or so you have to have a certain amount in there to make it active,
To make
To make-
that mother,
to make it mother tincture. So if you take calendula, mother tincture, or devil's claw, or whatever, right, and then you put it on your area of injury. If it's too dilute, if it's too weak, if there's not enough of the original substance there, it's not going to have an effect. So it has to have enough to be on the effect.
so is then each one different then, I guess is where I'm trying to.
Yeah, so the original mother tincture is usually made by a herbalist, right? The homeopath will take that and then dilute it. Yeah. So if you do the whole process from beginning to end, then you got to learn more than just homeopathy. You have to also learn how to do tinctures and preparing herbs, drying them. There's a good time to dry them. There's a good time to pick them. If you pick herbs in the early morning, it's better than if you pick it in the late in the evening, in the middle of the sun. How you dry them. Everything matters. So yeah, and that's a whole process. Yeah. There's a really good book. It's called by Maurice Messigue. Have you heard of him? I think it's gone on plants, medicine and plants, or something like that. I read it a long time. It was a really nice read. It was just him and how his connection with plants, and how he would just always go around and pick plants and pick herbs and things he made out of them, and his experience with treating conditions, and he had a very interesting Maurice Messigue, his name is, and he didn't even give people herbs orally. He actually just made them put their feet in it. Yeah, put feet and hands in it, because it's transdermal absorption. So herbs have many ways of getting to the body, and his successes were phenomenal. He became a famous person. I think he also treated the English royal family. He was their herbalist or doctor for many years, and very nice. This whole world of just plants and preparation of things is wonderful, but that's the world of herbalism. And then homeopathy comes from it's the next step.
Right.
And it's homeopathy. You'll see it's very psychological analysis. There's a huge element plants. You don't have to see. Oh, are they feeling do they want to be left alone, or do they do they like having their kids around, or do they like hot drinks or cold drinks? No one cares in the herbalism. You just go ahead, just give it. But the homeopaths ask about these things. So apis, and there's another one. It's called ledum. So ledum, I said, it's also for insect bites, but there's a slight difference. So ledum is for congestion, right? That venous congestion. It's not it's puffy. It's not, and stuff is not moving out. But apis it's very, very red and hot. So both these remedies are for a bite from a.
Says animal too?
What was that?
It says animal as well, so like a cat or a dog bite?
For ledum?
Yeah, it says apis, and then it says bee stings, insect or animal bite.
Yeah, for a tick bite. I guess even for a dog bite. Yeah, sure, because you could get infected from it.
Because cat bites are usually pretty bad.
Oh yeah, you could. Yeah, that's right. Because you can be infected by it. That's right.
So apis?
That would be ledum. Apis is more for the red hot like a bee sting. It can also be used for just like, someone, they have a red hot painful injury that's causing a lot of pain, swelling, even around,
Burning sensation?
yes, there's a burning sensation, yes. So it's worse by heat, and it's already swelling, and it's stinging, it's swelling, it's strong, hot injury. Again, the interesting picture with apis is that they're for some reason they're thirstless. It's also can be for like hives, like a hive-like reaction. Apis.
So like for like, poison ivy or poison oak or something like that would be apis too, or?
You could use it temporarily for some relief. Mm-hmm. Yep. And then ledum is more for the bug bite that's causing venous congestion. I actually used ledum for one of my sons who had like a tick, and I kept on give it to him every day, and then I moved it into once a week, then I moved to every other week, and then I moved into like once a month, just to make sure there's no symptoms left of the tick bite. But ticks, it's better to, if you do see a tick and you know it's been there for more than 24 hours, you should probably just go into a pharmacy and get that they have like antiviral, antibacterial, just in case. But this wasn't that long. Still, out of caution, I did it.
That was leader.
Ledum, which can also be used for, remember we covered it earlier. What is ledum also can be used for?
For bruising. It repairs
Yeah, for,
things that are inflamed.
yep, for a fracture, right? If it's like a lot of congestion in the area, you want to just clear up. And and ledum is also there for if the skin has been punctured. So like there's like a puncture wound.
So with
Cat bite, like you said, cats sometimes can do that too.
tick bites,
Yep.
like just when you see some redness, like we get the circles, then you're beyond this?
You're beyond. Yeah. If it's been 24 hours, it's been in there. You should definitely go to the pharmacy and get your stuff. But you could use ledum on top of that. It'd be safe.
But
'Cause-
like for your child, was it just because there was some redness and you're just making sure it was clear?
Yeah, I just did it because there was some redness, and I just didn't. I didn't. It wasn't that long for me to go and get any meds, but just in case if there's any side effects, any reaction, I used it anyways. Okay. Ledum. Oh, this is a great remedy. Cantharis. Look up what this is made of. Someone look up why you'll be surprised. Such a good remedy. I've used this so many times.
Oh. My mind's imagining.
Oh yeah,
Soldier beetles.
yeah.
What was that, sorry?
It's a large genus of soldier beetles.
Soldier beetle?
Yep. And what do the soldier beetles do?
It looks like to manage symptoms of intense burning, inflammation, and blistering. So I'm betting if they bite you, you have extreme burning, inflammation, and blistering.
Yeah, these bugs, these beetles have that. So Cantharis is for any sensation of extreme burning. I used it just, have you ever seen someone like spill something really hot on them and the skin starts bubbling up and everything? So when you get to that point of bubbling, that's a very serious burn. And the pain is intense, and sometimes the healing does not take place very easily. But if you give a Cantharis, whatever capacity the body has to heal itself, it'll fix it. So yeah, to the extent the body has capacity. So yeah, my wife has many times burned herself. I've given Cantharis. Cantharis can even be used for urinary tract infections and times where things like just really burning sensation.
This is internally.
The burns, internal.
Yeah, like we saw.
Online it talks about urinary tract infections.
Yep, yep,
So burning sensation with that.
yeah.
Like heartburn too, or no?
A hard heartburn is not. No. This is like burn, like how do you say, like heartburn is not really like a burn unless it actually feels like fire burn. Heartburn is usually like a discomfort, right? But like I'm talking about
External.
I'm talking, well, it can be internally too. Like a UTI, urinary tract infection, is a, yeah. Mhm.
So you're talking actually, I hurt myself picking up
Yeah.
a pot.
Yep,
off
yep,
the stove with
yeah.
a bare hand.
Yeah. So you take that, you do, so burning pain in that area, it could, it relieves the severe pain following a burn. So because the sensation is really burning, and if you take this, it'll decrease the so you don't have to put like, sometimes people put various creams on their burn. You could use this remedy without having to need the cream because the body will just feel better. Because they're very irritated after this. They're in a lot of discomfort,
So it could be a
and it helps to promote the healing.
bad sunburn?
Sure, yes,
Oh.
a very bad, but it has to be.
Extreme.
But yeah, it's like the guy. Did you fall asleep for 5 hours in the sun? Oh my god, get that Cantheris, you know?
Like with blisters.
Yeah, but yeah, exactly.
So with UTIs, does it take away the pain or does it actually help with the healing too?
It will, yes. But it has to match though. So UTIs are also they're very different types of UTIs. So like when you like if for instance if you had someone who had a UTI and you wanted to help them out, and you said, what are some homeopathic remedies for UTIs? It'll go through, say Cantheris, it'll say Staphysaurus is another remedy, and it'll have a couple of different remedies, and then it'll say go drink some cranberry juice without sugar and vitamin C. So throwing like a Cantheris in the mix, like you did cranberry juice, you did vitamin C, you got your sleep, you drank a lot of water, and you tried Cantheris, not a bad idea. Like it's like a good healthy combination approach that can get someone right out of it without taking antibiotics. But if it persists, like you did everything and it's like go you better get antibiotics. You don't wait around, or you can do it with it.
Because some people get it so quick that the pain is so sharp. So
Yep.
quickly, it doesn't build,
Yes.
it's just boom, so.
Yeah. What if the pain was not neurological? Was not burning, but it felt like sharp, and a sharp nerve pain? Yeah. That's a different symptom. You guys getting it? Yeah. Isn't that cool? Oh.
Like, this is great.
So what we'll do is we'll end here. We have maybe like another 10, 15 remedies to do and a couple other conditions. And what I'm going to do, next week when you guys come, I'm going to quiz you guys, okay? So get familiar with your, all right? Did you guys go back? Did you guys kind of relook at the notes at all and over the week?
I didn't this week, but I did the week before.
Okay. How do you guys feel about the whole thing? Like, do you feel getting the hang of it?
Yeah, starting to understand it a little better.
Okay.
I'm curious as to who or what decided to crush up a beetle to figure out.
Oh man,
You ever squished a bug before?
I mean, I didn't want to put it in a solution.
What fascinates me is it's all internal, none of it's topical. Like, if it's burn on the skin,
Yeah.
you heal it through the inside, not through the outside.
Yeah, because you're trying to give the body a best
Yeah,
ability.
that's
So
what
would the
blows my
topical
mind.
be botanical and herbalism rather than homeopathy? Like if you were to use a slab per se?